Hello everybody, welcome back to my channel. My name is Pinky. I'm the clinical pharmacist practitioner. Today I'm going to discuss about a topic which is quite difficult to discuss indeed. It is a gynecological condition and it is the second most commonest condition in UK after fibroids. Now, what happens in endometriosis? So let me explain about the menstruation cycle and or period. So in menstruation, what happens? There are cells and tissues inside the uterus which responds to the hormones of the menstrual cycle, and when it responds to the hormones of menstrual cycle, bleeding happens. In women with endometriosis, the cells and the tissues inside the uterus, they grow outside the uterus. And these tissues and cells which grows outside the uterus, they respond to the hormones of the menstrual cycle and causes bleeding. This bleeding causes inflammation and this leads to pain, because this bleeding can also cause the tissues of the other organs to stick together. So how do we manage endometriosis? We manage endometriosis by hormonal treatment to stop this bleeding to happen. So we would suspect endometriosis with more than one of the following symptoms reported by any woman or any girl. So the symptoms can be pelvic pain, prolonged menstruation, prolonged period, which affects the quality of life. Then there will be pain after having sexual intercourse. There can be painful defecation, and in urine there will be blood, and it will be painful urination as well as another symptoms. And if someone is trying to conceive but can't conceive, that's a symptom as well for endometriosis. In order to investigate further, there will be examinations that will be carried out, imaging will be done, biopsies can be done to confirm endometriosis. Let's discuss about the management now. For the pain, paracetamol, ibuprofen, naproxen can be taken, and hormonal treatment can also be advised to stop the bleeding. So when we will refer the patient to a gynecologist, to hospital, we are going to refer the patient when there will be severe, recurrent, persistent endometriosis. It is not responding to treatment. And another thing is, if fertility is an issue, if somebody is trying to conceive but unable to conceive, then we are going to refer the patient as well. So the main thing is, if it is recurrent, consistent, endometriosis, not responding to painkillers, not responding to hormonal treatments, and the patient wants to conceive but can't conceive, then we are going to refer the patient to a gynecologist. Surgical management is another option. It's an important part in managing endometriosis. However, it's not a cure and it carries high risk. In mild cases, if subfertility is an issue, we should refer the patient first rather than prescribing any hormonal treatment. Another important thing to note is that endometriosis is a hormone-dependent condition and it generally resolves in menopause. I would like to discuss a bit about the hormonal treatment. Now, it is impossible to say which hormonal treatment will work best and which one will not. So if you're having side effects with one hormonal treatment, you can inform the healthcare practitioner that yes, I'm having side effects with this hormonal treatment and it can be changed to something else. Now, at least you have to give 3 to 6 months to see any effectiveness of these hormonal treatments basically. And there are many different formulations of hormonal treatment available, such as tablets, intrauterine devices, injections, and implants. Now, these hormones also act as contraceptive pills. These hormonal treatments can be stopped anytime if you want to, or if you want to conceive or trying for a baby, these hormonal treatments can be stopped. It's very important to understand that before you start taking a medication, the most important thing is read the patient information leaflet. Reading patient information leaflet will give you the idea what are the side effects, what are the contraindications, what do you expect from this medication, how to take it, when to stop it, and so on. Thanks for watching. If you have any questions, put in the comment section below. Don't forget to like, share and subscribe. Thanks a lot for watching.